Device closure of atrial septal defect is almost replacing surgical ASD closure in all cases with suitable morphology. Percutaneous ASD closure is usually well tolerated. A rare complication in literature following device closure of ASD is pulmonary edema. Acute pulmonary edema is well reported after surgical closure of ASD, especially in elderly, when a sudden increase in preload of a poorly compliant and small left ventricle leads to diastolic heart failure. One of the earliest reports of left heart failure after device closure of ASD was in a 78-year-old female who had a left ventricular ejection fraction of 65%. She developed acute left ventricular failure and pulmonary edema 2 hours after device closure of ASD with LV ejection fraction of 20%. She needed mechanical ventilation, catecholamine support and high-dose diuretics. She had to be in hospital for 2 weeks after the procedure. Low preload, which was there due to ASD for decades, would have predisposed for LV failure with sudden increase in preload after device closure of ASD. Similar episodes have been reported by other workers as well. In a large series of 529 patients undergoing ASD device closure between 1998 and 2008, Tomar and associates had 3 patients with transient pulmonary edema. They needed intensive care for 2 days post-procedure. Burt and colleagues successfully used left ventricular preconditioning to prevent acute left ventricular failure in patients aged above 60 years undergoing device closure of ASD. They assessed the response to balloon occlusion of ASD, and if mean atrial pressures rose over 10 mm of mercury, device closure was deferred and LV preconditioning applied. LV conditioning was with dopamine, milrinone and furosemide 48 to 72 hours prior to definitive ASD closure. This was needed in 1/4 of their elderly patients. Device closure was done after conditioning in all but 2 who were given fenestrated device because atrial pressures remained above 10 mm of mercury even after pre-treatment. First set of references. Second set of references. Thank you for watching this video. Please subscribe, like, share and post your valuable comment below this video.